Hi there. This is the Pennsylvania Clinical Network podcast, where we feature our network's talent and the positive outcomes that they yield every day at the PACN. I'm Dr. John Pagan, Chair and CEO of the PACN and your host. It's my pleasure to welcome PACN Senior Director of Quality, Wendy York. Welcome to the show, Wendy.
Thank you. It's good to be here.
Wendy, please tell us the story of how you ended up at the PACN.
Sure. I began my career years ago as a medical assistant working in a very busy primary care family practice. I continued my education, completed my education, moved through the ranks, and spent much of my professional career in practice and healthcare management. I did spend some time as an office-based coordinator for University of Pennsylvania's disease management program, where I educated practices and physicians on best practice guidelines. And this is where I really gained a passion for quality care and quality care delivery. When I was approached about an opportunity to join the Care Center Collaborative, I was serving as a practice director for a large hospital system in the Lehigh Valley, where I was responsible for multiple primary care, family medicine practices, and a multi-service line health center. Quality care and metric reporting was a large focus for me. The PA network opportunity intrigued me, and the more I learned, the more interested I became in looking closer into it. I've always been passionate about helping others and making a difference, and I saw this as an opportunity to make a positive impact on the physicians and practices that wanted to remain independent by providing them the tools and resources to stay in control of their practices and their day-to-day operations.
Wow. So we are welcome, we are lucky to have your talents there, and so grateful to have you at the network with us. I understand that within the PACN, your roles evolved even once you got here.
Yeah, I began in 2018, began as a director of practice support and partnerships, where I met with independent physicians across the state, promoting and detailing our clinically integrated network that we were at that time forming. I explained how joining could benefit their practice. And in 2019, I moved into the role of Director of Clinical Outcomes and Quality and worked very closely with our, at the time, medical director on quality initiatives and developing our physician committee infrastructure. As our network grew and we secured 7 value-based contracts, our quality department expanded, and I moved into my current role as Senior Director of Clinical Outcomes and Quality in late 2020.
Right. I think you bring up some key points in that, and certainly one is the evolution of the network. Not only your roles, but the network. And in the beginning, we were focused on recruitment and growth, and now we're certainly very focused on outcomes and performance, and that's where you and your team really play a big role in that. What does it mean to you? I guess, given your background and the clinical basis in helping a lot of family practices, helping independent physicians still seems to be a passion for you, and certainly for the network. Can you explain a little bit more how important that is?
Sure, I think it's really, really important because the independent physicians, they don't have the same resources that the employed physicians do. Many tasks and costs, such as hiring, training, credentialing, billing, liability insurance, and much, much more, are the sole responsibility of the independent docs and these independent practices. Also, the independent physicians lack the clout with the health plans, usually having small membership in each health plan, and they're unable to negotiate, better paying contracts on their own. So by aggregating those lives into our, all the independent practice lives together in one unit, we can gain better negotiating power as a group and obtain more lucrative value-based contracts, resulting in increased reimbursement for the physicians and the practices that are already delivering excellent patient care to their patients.
I think you hit on one of the key points, and certainly thanks to our whole network was born out of the idea and vision of the Pennsylvania Medical Society to allow practices to make their choice, and have an option into how they practice and where they practice. For some doctors, it may be working in a larger network with a larger system, but for others that wanted to maintain their independence, being able to come together or aggregate with our network is important for them to access these quality programs, which, as you said, independently, they really wouldn't be able to do that. But brought together under one roof with a single electronic data system that's linking each of the varied EMRs or whatever record keeping they have, allows them then to participate in these contracts and do it. And we're starting to see now, after a couple of years of working with your team, the benefits are starting to pay off. What are some of the key elements of success for a practice that your team emphasizes to maximize their value-based recognition?
Yeah, certainly. Annual wellness visits and getting patients in early in the year that haven't been seen, say, the prior year, is a huge emphasis for us. Getting patients in early ensures that gaps are addressed and allows patients enough time in the year to get those routine tests, screenings completed by year's end. Pre-visit planning has become huge. It ensures when your patient, when you see your patient, the office is efficient and as productive as possible. You're not running around looking for, consult letters, labs, diagnostic tests, discharge summaries, etc., because you have all them there in the chart prepped ahead of time. You know what's still incomplete, if anything. And ideally, the nurse or MA completes this comprehensive review of the patient and pens orders in the EMR and preps the chart for any outstanding items, 1 to 2 weeks and ahead of the office visit is ideal. And this has become an essential and critical element that will improve your daily patient throughput and overall quality performance. Another factor is this risk coding and hierarchical coding condition categories. These are categories representing diagnosis codes for serious chronic conditions. And then this is done as part of pre-visit planning. It's reviewed and identified any condition that has not been newly identified and coded, maybe through an ER visit, hospital or specialist visit, or a condition that's still present but hasn't been coded this year. This ensures that we get a complete picture of the patient's health. Patients must be coded at the most specific level of their disease and should include complications if they're appropriate. And conditions still present from one year to the next still must be revalidated each year. So this has been a critical element as well. And the final, and probably my team would say is one of the most important aspects, is CP2 code billing. And these are pseudo billing codes that don't really carry a dollar amount. They're used to report to the health plan that the service has been completed to satisfy the measure. And these include measures that require a result, like a blood pressure reading or an A1C result or depression screening and others. And once the health plan processes the claim, the specific gap becomes compliant. I think these are probably the essential elements for success.
Sure. I guess, like so many other things, preparation is the key to success. And today, with such the busy demands on a practice and a physician going through a day and all the unexpected things that a patient may bring to a visit, having outlined or prepared for that visit is so important, because it's so easy to miss those things, the annual cancer screenings and all the other things that you speak of there too. And certainly your team has been very helpful in any of our practices that need a little help in how to best do the CP2 billing, how to best do the advanced planning. I know you have guides and outlines and helpful tips for them, and certainly can help walk through any of our practices in doing that. Again, preparation is the key to success. So over the next year, well, you have such a talented team there. anything you want to comment about your quality directors that are working with you and some of the talents they bring and tips they have for the practices?
Sure. The quality team is very committed. They're competitive. They're a high performing group with extensive experience in HEDIS and STARS measures and a vast knowledge of health plan operations. The team is responsible for creating over 40 tip sheets and over 20 resource handouts that directly assist practices with measure guidance and improving practice workflows. Quality team is truly HEDIS and STARS subject matter experts. They provide monthly outreach to practices, providing knowledge, guidance, all pair gap reports. They provide timely, relevant information with great suggestions, and they tailor each practice's they tailor their approach to each practice's specific needs.
Well, that's fantastic. I guess in winding up our podcast there, what do you value most about the PACN and its future?
Well, I'm extremely proud to be helping and supporting independent physicians of Pennsylvania as they provide excellent, high quality care to their patients. It's certainly quite evident in my experiences with these physicians and their practices. They're highly committed to the well-being of their patients, and their patients are extremely loyal. I'm looking forward to building on our current successes so that our practices will not only survive in this ever-changing world, but actually thrive in the evolving world of value-based care.
Well, again, thanks for your time today. This wraps up our conversation for today's show. We really appreciate your quality insights that you shared with our audience, and more importantly, the accessibility of you and our team to our physician members and their practices at any time there. Once again, I'm Dr. John Pagan, CEO of the PACN and your host. Thank you for tuning in to the latest installment of the Pennsylvania Clinical Network podcast.